Our community advisory committees and clinical councils have a really important role in informing our work as a primary health network. They provide really valuable guidance and advice about what's happening in local community and as a PHN, how we can respond to that.
So those two committees, the Community Advisory Committee and the Clinical Councils, are really key roles stated in their name, advising the board and the organisation of some of the issues, or a lot of the issues that occur in our regions. And they provide important, credible and valuable information to our board about issues in the local areas, from a clinical perspective and also from a community perspective. And we use the combination of those two perspectives to guide what we do as a board.
Look, it's made up of the sector chairs from the MPHN district, of which there's 4 plus WAGA, and also the MPHN staff. And it's a forum where we can bring to the table as healthcare advocates for our communities any issues, what's happening in the community, what's not happening in the community as far as primary healthcare is concerned.
Our PHN covers 124,000 square kilometres, and we know that the communities that we serve are incredibly diverse and vast across such a large geography. It's really important that we remain connected to local communities and we have that feedback from people living and working in their own communities about what might work or what we might need to do differently.
I was asked to get involved when I was still a registrar, doing my training towards general practice, and I found it a great opportunity to be able to provide some insight and feedback into some of the challenges facing registrars in the area at the time, and how we could potentially help support doctors in training to complete their training and entice more to come to the area.
I'd reached a time in my career, I've been a general practitioner in Denny for 35 years. I thought I had a bit of an overview and a bit of an experience of healthcare and healthcare systems, and I wanted to start giving back. An opportunity came to be involved in the primary healthcare network. I started getting involved and had the incredibly refreshing experience of being listened to, getting feedback, and that people were actually acting on the suggestions that we were making.
It's really important for the board to hear from community and from health professionals, because we make decisions in a strategic space. So we're at one step or a couple of steps at times separate from the decisions that are being made by clinicians in a day-to-day sense with their patients and consumers. We're also that couple of steps away from community members who are making decisions about how to access health services. So when we help to design or want to implement new health services, it's really important that we know what's going on the ground, and our community advisory councils and our clinical councils really provide us with that grassroots information to guide what we do with funding that's provided.
I thought it would be a good opportunity to network with other health professionals, not just dietetics obviously, but also lots of allied health and GPs on the council, and it just gives, it's a good opportunity to have input into the health system. And it's been really interesting actually, I've quite enjoyed it.
Look, I'm really passionate about the health of my community, which is Griffith, and I'm able to be a voice and bring that higher up the chain to the primary health network and feedback, those concerns or those issues that my local community are going through. And as I said, I find that a real privilege to be in that position, and I am very passionate about healthcare, and particularly those vulnerable groups that don't have as good access, and there's barriers to that access.
I think health clinicians need to be advocates for their clients and be able to assist them in be able to find the actual healthcare that they require. There's so many other funding pathways that they can get access to, and we can then advocate for them, not only in their mental health, but also so many other factors that are not just involved in their, from my personal point of view, the podiatry point of view, but also be able to advocate for their mental health and other pathways that they can get involved in as well.
As a community healthcare advocate, it's important for us to have a voice to enable our health outcomes to be better. And as I've said it before, particularly our health outcomes are not as good as those of the cities. And by us having a voice, hopefully we can have influence over those health outcomes.